People looking for early vaccination against COVID-19, perhaps to travel, will have to wait for their turn. But they may be considered when vaccine supplies become more certain. Senior Minister of State for Health, Janil Puthucheary, says that vaccinations will continue to be prioritised for those who are at the highest risk.
Vaccine shipments will be delayed because Pfizer is upgrading its manufacturing plant. Senior Minister of State for Health, Dr. Janil Puthucheary, says the government is closely monitoring its supplies. But he says Singapore has the ability to vaccinate the entire population by the third quarter. Those hoping to get an early jab will have to keep their fingers crossed.
We completely understand the anxiety of Singaporeans who wish to travel overseas for personal reasons or who would like to get vaccinated early. At this point, when vaccine supplies are limited, we do need to prioritize our healthcare and frontline workers and seniors for vaccination. We are therefore unable to provide vaccines at this time to Singaporeans outside of these groups and seek their understanding. When there is greater certainty in our vaccine supply, we will consider allowing these individuals to receive early vaccination.
As of 31st January, more than 155,000 people have received their first jab. To get more people vaccinated, about 40 vaccination centres will be set up. Each centre can vaccinate about 2,000 people a day. Vaccinations will also be available at all 20 polyclinics and at more than 20 public health preparedness clinics. There are also mobile vaccination teams who can reach out to seniors who have difficulty with mobility. Of all the people vaccinated so far, only 4 had severe allergic reactions to the COVID jabs. All have recovered. Addressing concerns raised by MPs, Dr. Puthucheary said there is no evidence that the vaccine contributes to an increased risk of death in the elderly. That's according to studies by Norwegian health authorities and the World Health Organization's Vaccine Safety Committee.
Currently, the benefits of getting vaccinated to protect oneself from the effects of severe COVID-19 disease and its complications far outweigh the risk of any potential adverse events known to be associated with vaccination. We will continue to closely monitor the safety of the vaccine and ensure the vaccines used in Singapore are safe for our population groups.
Migrant workers are also in line to get the COVID shot.
The communal living and working conditions of migrant workers in dormitories puts them at a higher risk of infection, as well as the formation of large clusters. The prioritization will also depend on the risk stratification of the dorms, and obviously those at higher risk, we will vaccinate them first.
He says the government will be working with non-profit organizations to communicate the vaccine rollout plan to migrant workers.